now we're going to examine the ears and the nose. We're going to start with the ears. The first thing we want to do is we want to inspect the ears. They are symmetrical in size and shape. They line up with the outer canthus of the eye. I don't see any lesions, erythema, swelling. I see no drainage from the ears. On either side, I'm going to palpate the pinna. Is anything hurt here, sir?
No.
I'm going to palpate the tragus. Is there anything painful
No.
there? I'm actually going to move the ear, and then I'm going to look in the back here for any lesions, and then also the tops of the ears. Fantastic. Okay. There are no lesions or tenderness. Now he's going to cover one ear for the whisper test. This is the acoustic nerve, cranial nerve 8. If you could cover one ear, please. And I'm going to measure the right ear. You're going to tell me what I'm whispering.
Baseball.
Great. And cover the other ear, please, and tell me what I whisper.
Cookie.
Excellent. So his hearing is intact via the whisper test. Now I'm going to look inside his ear. I'm using my otoscope. So what we do is we pull the pinna up and back. I look at the external canal. I'm looking for drainage, erythema, swelling, any lesions, which I don't see any. I don't see anything blocking my way, so now I can insert. I see a little bit of cilia and cerumen in the external canal. And now I'm advancing and looking at the tympanic membrane, which is pearly gray, slightly retracted over the malleus, which is at 12 o'clock. And I see the cone of light at 7 o'clock. And there's no swelling or bulging of the tympanic membrane or any other lesions. Now I'm going to look at this ear. Again, I'm looking for any obvious drainage, swelling, erythema, lesions, which I don't see. I'm going to insert this. There's no foreign bodies. I'm looking at the external canal. There's a little bit of cerumen, and there is a little bit of cilia, which are expected findings. There's no lesions, swelling, erythema. I'm looking now at the tympanic membrane, which is pearly gray, retracted over the malleus, which is at 12 o'clock, and I see the cone of light at 5 o'clock. So everything is intact in the ear. Now we're going to go and do the nose. So the first thing I'm going to do is I want to inspect the nose. The nares are symmetrical. The septum is midline here. There's no obvious drainage from the nose. I don't see any lesions, no lumps, I'm going to take a quick, first I'm going to palpate the nose. Any pain or tenderness here, sir?
No.
Great. I'm just going to take a quick look in the nose. The nasal tissue is pink and dry. I see cilia, which is a normal finding. There's no drainage. There's no exudate. There is no erythema or swelling. The septum is intact. There's no lesions. In here, I see also the turbinates, which are slightly darker pink, but there are no lesions or exudate on the turbinate, the lower turbinate. So now I'm going to ask you, we're going to determine patency of the nose. So if you would just cover one nostril, please, and blow in and out. Good. And then cover the other nostril. Good. And the flow of air coming out of both nostrils is symmetrical. So we assume that it is nicely patent. Now we're going to check his sense of smell, which is the olfactory nerve, cranial nerve 1. Mr. Moore, could you please close your eyes and cover your nose, one nostril, and can you tell me what this smell is?
Ginger.
Yeah. And now could you please cover the other nostril and tell me what this smell is?
Cinnamon.
And you are correct in both. So now we know that the nose is patent and his sense of smell is intact.